Who was it that testified on behalf of the defendant? His name is Sigurd Bergen, MD. Stanford, Oxford, Harvard. He's the head of the spine department, the largest on the West Coast at UCSF. Okay. He continues to do surgeries. He's been ongoing. He deals with, he's a chair of both neurosurgeons and spinal surgeons. He uses Infuse regularly in his practice, virtually all of his anterior approaches. It's true that when he does posterior approaches, he typically does big surgeries, so he has access to the iliac crest, and therefore he doesn't necessarily need to use Infuse. But he uses it regularly, nevertheless. But he always uses it in the front, and he regularly uses it in the back. Okay. We went through his qualifications, his honors, and you've heard him. And the first question is the expert's training and experience. He is a current director of the department at UCSF. Okay? Who is Dr. DeHaas? Let me go to your instructions. Section number 203, which is page 12 of your package. You may consider the ability of each party to provide evidence. If a party provides weaker evidence when it could have provided stronger evidence, you may distrust the weaker evidence. Where was Dr. Rosen on the issue of standard of care? The head of the director at UCI. He's doing surgery currently, if not every day. He told you about his practices. Where's he? Did they not have access to him to bring him in on the question of standard of care? Did they not have access to him to come and tell you from a standpoint of being knowledgeable about it? Did they not have the ability to provide you stronger evidence and decided instead to bring Dr. DeGalle? If you believe that true, then you may distrust the testimony of the weaker evidence. I don't believe there's any question but that they have the ability to do it. And you have to decide why not. He was here. He could have been asked. Why do you think he wasn't asked? Why do you think Dr. Rosen wasn't asked whether, in his opinion, Dr. Dobkin breached the standard of care?